Hello, everyone, and welcome to the May HICP Health Innovation Community Partnership meeting. As we know, this is our first hybrid meeting where half of our participants will be joining us in person at the inpatient tower room at Los Angeles General Medical Center, and the other half of our audience will be joining us via Zoom. We're going to give ourselves a few more minutes to collect and gather more people who plan to attend the meeting and may be running a little bit late. So stay tuned. If you're in the meeting room with us, please grab some coffee, grab some refreshments, and we'll get started in just a few moments. Greetings to everyone in the Health Innovation Community Partnership Zoom room. Just to let you know, our meeting will start in a few moments. We're waiting for our in-person audience to grab their coffees, catch up with their friends, and we'll go ahead and get started very soon. Stay tuned.
So we only have now 25 people, 30 people on the phone. For our first person, 4 years. Yeah.
Yeah. Not right now.
Yeah, that's what
This is being projected.
Good morning, everyone. Thank you for those of you on the phone that have been patiently awaiting the start of the meeting. We have a good critical mass here in the room. We're really excited about our first in-person meeting. We were mentioning that it's been a number of years since we've been able to have our in-person meetings. So we're really hoping that we can at least have one of these once a quarter. And today will be a very interactive day. So we're going to try to include those of you on the phone as much as possible, but a real encouragement that you come in person for those that events that we'll have in person so that we have more opportunity to engage with you and to sit together as community to respond to the needs of our incredible campus and future developments in our healthy village as we move into the future. So Rosa Soto with the LA General Foundation and the Wellness Center. So really excited to be opening up today's meeting. And again, thank you everyone for being here today. We're going to go through the community agreements and then we'll get started with our briefing from LA General. For those of you who are here today, we're going to have an incredible opportunity to walk outside and look at some of our mobile units that are being used for some of our street medicines or our medicine team that is going out to support those that are unhoused or having difficulty getting to us because of the insecurity of housing or maybe where they're staying, right? So we'll talk a little bit more about that in a little while. But again, thank you, everyone. This meeting is being recorded and will be posted to the HICPLA.org website. All attendees, please mute yourselves unless you are speaking. Turn on your audio and video so that we can see you. And if you need to use your microphone, there's an on and off next to the camera icon. Click the raise hand button if you want to ask a question and type your questions into the chat. Interpretation allows you to attend in your language of choice. So for those that are in the room, can you raise your hand if you can hear me in your language of choice? Si nos oyen en español. Excelente, muchísimas gracias y bienvenidos a todos. Estamos muy alegres de estar aquí con ustedes y seguiremos la junta en inglés por la interpretación, pero sabemos que si hay preguntas en español, los podemos dirigir en español y en inglés.
So hello again. We're very excited to be welcoming everyone to our May Health Innovation Community Partnership. As discussed, this is our first hybrid meeting, the first opportunity we've had to be in person together since prior to the pandemic. We're so excited to be creating an experience for both our in-room attendees as well as our virtual attendees. Please bear with us as we work through the technology challenges to make this a really fulfilling experience for everyone. As we look ahead to our agenda, we're really excited to have our interactive mapping exercise being hosted here in person at Los Angeles General. We also are looking forward to the updates from the LA General Medical Center, as well as that street medicine update. And lastly, as Rosa mentioned, those in the room today will have the opportunity to visit some of our mobile health units out in the parking lot in front of the inpatient tower. So looking forward to sharing all of those wonderful updates with you today. And with that, we'll move forward into our community agreements.
So when HICP was first started, we wanted a space that was respectful and designed in equity so that everyone would have a place at the table. So all of you who started this initiative with us have been part of building our guiding principles. So the first one, all participants agree to basic principles that prioritize equity, community resilience, and health in all programs and projects. All participants agreed to approach issues with an open mind and be willing to engage in dialogue and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues or arguments and move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or the institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will arrive prepared for the meeting, and during our meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work on we work to develop a comprehensive common set of information with which to solve problems and make decisions. Participants will jointly design next steps. And with that, I think we will move to our first presentation. So I'd like to invite Edgar Solis, Dr. Chase Coffey to come up and give our briefing for LA General Medical Center.
Good morning. Buenos dias. I was just reminded that the last time we met in person was about 4 years ago. And if we think back at what happened during the past 4 years, it's been a long journey. And I started actually in January of 2020, and I think I came to one of the last HICP meetings. So it's great to be in person again, finally see everyone's faces again. And welcome to LA General, and it's great to have you guys here this morning. We wanted to provide a quick update. We recently reached a historical milestone for LA General that hasn't been done. And through the partnership and leadership of many medical, clinical leaders, non-clinical leaders here at the Medical Center, I want to invite Dr. Chase Coffey to give us a little bit more information of this historical, monumental achievement.
Good morning, and thank you, Edgar. Buenos dias. I am Chase Coffey. I'm an internist by training, and I'm the Chief Quality Officer here at the Medical Center. And we are thrilled to share with this group that our Medical Center received the highest marks for patient safety from a leading patient safety survey group. The group is named Leapfrog, and they are similar to various grades that you may hear from U.S. News and World Report or our Medicare or CMS safety ratings. Through a lot of hard work across many disciplines, from the physicians to the nurses to the administrators to our technicians and to our patients who are speaking up for patient safety, we achieved a Leapfrog safety score of A. That is the highest score you can get. Yeah. Thank you. This has been a 9-year journey. We started at a B, we dipped as low as a D, and then have come all the way up to an A. Now, the job is not done. We know that we have improved the safety of the care at this organization. We are already turning our focus to how do we maintain that safety and start to ensure that our other publicly reported data and rankings actually reflect the high quality of care that we deliver here at this medical center. So I would be delighted to come back in the near future with updates on our efforts there. And in the meantime, please, I encourage you and your organizations and your family members and patients who come here to speak up when they see something that is not worthy of our world-class care to our world-class community. I'm happy to take any questions, but we just wanted to share this really good news, and we hope to maintain this grade for years to come. So thank you.
Dr. Coffey, I know you mentioned that, sometimes we've dipped to a lower grade. What does that mean? Because one of the learnings for me was, it doesn't take that much, and really we're always providing great care.
Yeah, thank you, Rosa, for that great question. And it is hard to understand what does it mean when a hospital has a B or a C or an A. We think of these grades like restaurant safety or hygiene grades that you see posted outside. They do reflect the rigorous processes and protocols we have in the hospital to keep patients safe. The challenge with this scoring system is it's done twice a year. And when we have safety mishaps, those mishaps can impact the score for several years at a time. So what this grade reflects actually is the progress and performance over the last 2 to 3 years. And so it actually illustrates the fact that we've been performing at a really high level for the last several years. And now the data are finally catching up to reflect the fact that our care has been excellent. I'll also put a plug. We are one of 5 public hospitals in LA County or in California that receive this acknowledgement. The other 4 are UCLA, UC Irvine, UC San Francisco, and UC San Diego. So we are an esteemed company, and the types of resources the UC systems have in their organization to put towards this effort. We are doing this with brute strength, teamwork, scrappiness, and a real drive to make sure that our patient care is the safest that we can make it.
So I'm sorry, I was with that. So my question is, when you talk about safety can be a lot of different things, right? So what specifically are they looking at? So I know that some patients can be a little difficult depending on their mental state.
Yeah.
And then does this also take into consideration the safety of the staff? So if you can just elaborate a little.
That's a wonderful question. Thank you for that. And I could spend an hour boring you with all the details. The safety score looks at the safety of care across our organization. It does focus mostly on the hospital, but it looks at our care in the ER. And in particular, it makes sure that we are not causing harm. So things like leaving in medical devices after a surgery that should have been removed, to making sure patients don't fall in the hospital or in the emergency room if they're here, to making sure that we don't cause infections by leaving in tubes or lines in one's body while they're here in the hospital. So it spans the gamut. Pressure injuries on the skin, medication errors, things that we call never events, giving the wrong medication if you have an allergy, cutting off the wrong leg when you shouldn't, right? Believe it or not, that still happens in some organizations. And so it requires an attention to detail across the medical center to really make sure that every step of the way is safe and that we're not causing harm? Great question.
I have a question in the chat. It
Yeah.
says, what was the major improvement that made the grade difference?
Great question. There were many improvements. I mentioned our surgery services. Occasionally, there are things left in the body. We've eliminated those. We have almost eliminated the falls that happen for our patients in the hospital, the injuries that occur when there's a bladder catheter or a long IV in the body. We have dramatically reduced our pressure injuries, which are injuries to the skin that occur when patients are lying in bed in the hospital. Our errors with respect to medications, giving the wrong medication, those have almost been eliminated. So it spans the gamut, and it reflects really a strong multidisciplinary effort across the medical center. Our nurses, our administrators, our physicians, and our patients speaking up when they don't see something or when they see something that is unsafe.
Thank you. I wanted to add a follow-on comment. It is, like you say, a relationship with the patients. And I've been privileged to kind of hear some of the internal conversations about how challenging it is to sometimes re-educate patients and work with them to overcome embarrassment or concern of, raising their voice. So it's not just an improvement in medical care, but it's really an improvement in a cultural conversation with the patients. And so I just want to uplift. That's, I know, been a huge initiative of this hospital as well, to really empower and
Absolutely.
educate patients into their role in their well-being while in care here.
A wonderful comment. And in fact, we need our patients to speak up if they see something that is unsafe. And so if you or your loved one is admitted to this hospital and they need emergent care, make sure your doctors and nurses are washing their hands every time they come in the room. Make sure that they're double checking that the medications you're getting are the right medications, that they're not meant for somebody else. We actually really need our patients to be partners in this effort. They play a really critical role to triple checking us, right? Just as if you were to go to a restaurant and they brought you the wrong meal, you wouldn't eat that meal, you would send it back. And so we need our patients to do the same for us, hold us to that high level of accountability.
Any other questions?
Wonderful. Thank you for the time. Appreciate it.
I want to thank Dr. Coffey as well for his leadership. I mean, it was just a transformation from our quality department and our quality advisors, and also Dr. Allison Liu, our patient safety officer, has been involved. It's not it's a very, as you understand, this hospital has very complex procedures and deals with very complex illnesses and diseases. And so it's a huge, huge undertaking. And I also want to acknowledge, to Heather's comment, the Patient Family Advisory Council that we meet with regularly that also informs our care. How can we improve the care from their perspective? So it's a collective effort, not only from our hospital, but you as well as community representatives. Thank you. Thanks, Dr. Coffey. We've partnered with the public health department in order to reduce gun harm, firearm harm at home. They have a program that distributes gun locks for different organizations, and we've partnered with them, and we are supplying that to as well. In our outpatient department, anyone can come up into the lobby and grab a gun lock. Gun harm is something that we want to prevent. Unfortunately, that still continues to happen. And so we're offering this device in order to prevent unauthorized access or kids getting a hold of firearms and harming themselves. Another exciting news, every Wednesday, which is my favorite day of the week, is Farmers Market Week here at LA General, where vendors set up outside of our courtyard and sell various goods and foods. And as you can, maybe you don't know that about me, I love to eat. And so I patronize, they know me already, Edgar, we want the number 4. Yes, that's what I want today. But what I'm excited to announce is that we've also now welcomed EBT and SNAP benefits. So that's a huge, thanks for the applause, Dr. Gonzalez. I mean, we feel it's a huge accomplishment for our community to have better access and more access to fresh fruit. I particularly like, there's a vendor that sells oranges there that are super sweet and juicy. And so that's now available to our community. So expanded access. We also want to share that we've partnered with LA Metro to increase our security in the various bus stops that we have on campus. Many of our patients access our medical center using public transportation, and Metro being one of them. So we want to ensure that as they use those services, they're clean, they're safe, they're well lit, that if there's information or any other issues that they need, that they have that information at the ready. LA Metro has sent over Metro ambassadors, and they've been stationed in the various bus stops around campus. What they've also done is these ambassadors are also riding on those routes to ensure the safety of our patients as they're either waiting for transportation or they're in the Metro services. We want to acknowledge and thank the LA County Board of Supervisors and Supervisor Hilda Solis for partnering with us, and the LA Metro Board for partnering with us in the safety of our community and our patients. We also want to communicate that we will be transitioning our outpatient mental health services to DMH. Now, this transition is to better align the services as a county as a whole. We traditionally, the Department of Mental Health Services does provide outpatient mental health to the community and the county. A small subset of these patients were seeking care here in our outpatient mental health departments. And so to align those services to the broader county procedure, we will be transitioning our outpatient mental health services to DMH. Now, this is a process that we've been working with Department of Mental Health for almost a year. And our guiding principle is to ensure that the continuity of mental health services for our patients and community is not interrupted. So we want to make sure that that transition is seamless, and so that our patients understand that they will continue to have those services. As you know, we will continue to provide inpatient acute mental health services here on campus, and we will only be transitioning that outpatient services to the Department of Mental Health. In about a month, I think, right? June 7th, we will be inviting DMH to answer any specific questions that you may have on this transition. And so we invite you to come back on June 7th and bring those questions forth as well. I'm particularly very excited about, is that we will be offering valet services to our patients. And I think that's huge. How many of you had a hard time parking today? Probably, right? Maybe some of you are shy and don't want to tell me, but we know that parking is a challenge here at the medical center, and we've tried to, come up with solutions on how to increase that. But one of the things that I think our leadership team here at the hospital is, how do we make that easier for our patients? What sometimes happens is they'll drive here, they'll go to lot 9, they'll go to lot 5, and they'll just circle the lots trying to find parking, and then they're late for their appointment. So what we've done is figured out a way to be able to offer valet services. So now, outside of the clinic tower, which is right in front of State Street on the corner of Marengo and State, you can pull into the clinic tower turnaround, and valet services will be offered. They'll pick up your car, take your car, give you a ticket, and that way you don't have to, go around the lots looking for parking. So this is something that I'm, very proud that we got done, and I think it's going to be a very well received, I'm sure, by our patients, so that they get to their appointment. Thank you. Thank you. So this will be launching on May 15th. And so if you start using valet services, just bear with us. We're working out the kinks, but again, you can leave your car there and we'll park it for you. It's free for patients with validation. Yes. So it'll be free for patients. All you need is, your ticket will get validated with the clinic that you're serving, or if you're a visitor, visiting a patient, you'll get validation. And so it's free of cost for our patients and visitors. I also want to invite you to our Sidewalk CPR event that we're having June 6th of this year. Sidewalk CPR is a modified version of the CPR that was provided. It's a hands-only type of CPR, which means you just compress on the chest. If by the time that folks, first responders come to help the patient, performing early CPR in a cardiac event when someone's suffering or their heart has stopped, it doubles your chance of survival just by doing hands-only CPR. So it's a very important skill to learn. And I had an issue when I was at a party and someone passed out and we went over and two of us provided two-person CPR and that person survived. So it does work. And so we invite you to join us on June 6th to learn that skill so you can be, if anything happens, you're ready and equipped to help out that person. And lastly, we want to invite you all on May 22nd here on our medical center to celebrate Asian American Pacific Islander Heritage Week. And we also want to celebrate all the contributions that the AAPI community provides here at our hospital and all the services and then the care that they provide for our community and our patients. So we invite you on May 22nd, 12 p.m. There'll be performances. We will have refreshments, right? Yeah, I always ask about that because I said I like to eat too. So we will have performances in that day and also community speakers. So we invite you on. I want to thank our PIO, Connie Castro. We're always coordinating these amazing events here. And we want to welcome you all to join us as well. Again, I'm very happy to be here, see everyone face to face, and I will hope we continue to do this every time we have this meeting. And tell your friends to come over. We like to hear from the community, and your feedback really informs our work. So thank you for being here today.
Okay. Oh.
So does anyone have any questions or follow-up comments for Edgar? And I'm inviting people from the Zoom room to please put your comments or questions in the chat and we'll read those aloud.
Yeah.
Hola, buenos días, respetables
días.
personas. Mi nombre es Alejandro Castro y solo quiero comentar que a mí me hicieron una cirugía colorectal superior en el centro médico. Un éxito y todos los servicios que comentaron de seguridad son verdaderos. Me tocó esa experiencia. No son palabras, es una experiencia. Gracias. Thank you. Gracias.
Muchas gracias, señor. And yes. I think what you'll find here is a medical center and healthcare workers that are committed to the mission and are committed to you as a patient. And that's what we do. We always say, you never know if you're taking care of one of our family members. One of our executive team members had their family member cared for here, and they chose to come here because of the exceptional care that we provide. And thank you for that comment. I'll take that back to the team. And again, we need to hear from you because your information, your feedback, it informs our work. Otras preguntas? Any other questions?
Doesn't look like it.
All right. Muchas gracias. Thank you.
Thank you so much, Edgar. All right, so we're done with our first presentation. I'm delighted to move into our next presentation, which is about the street medicine program that's being championed across DHS. We have some wonderful speakers, but I'll invite Dr. Carla Gonzalez, the medical director of the Wellness Center and the Foundation, to introduce the segment.
Thank you, Heather. Good morning, everybody. Wonderful to be with everyone here in person. I'm so excited. And really, this is a continuation of our presenters from this morning. Really what I heard is that we're taking complex issues and challenges and we're finding solutions together. So I'm very excited to introduce this next segment. This is a new team, a new addition to our already phenomenal LA General family. And they have been doing some incredible work with our community. As we know, we want to bring exceptional care to all of our community. And there's a special population out there with special challenges, and that is our unhoused population. So I am going to invite Dr. Absalom Galat, who is the director of our new street medicine team here at LA General, to give us a little introduction of what the work that they've been doing entails and what they imagine going forward. So without further ado, I'm going to ask Dr. Absalom Galat to join us. Thank you.
Thank you, Carla, and thank you, Josh, for inviting me. And I also have Matt Tekle with me from Housing for Health. And Matt is our director of coordination for our community partners at Housing for Health. So he's very, very important to the work. He's like our glue into our communities. That's why he's here. So if there's any hard questions, I'll punt it to Matt. So my name is Absalom, as Carla said. I'm the street medicine medical director at DHS. And within this role, I wear two hats. Within Housing for Health, we're the organization that are in charge of providing care to the unhoused within the DHS system. So we have interim housing bed, recoup care beds. We have the CBEST program that helps people get SSI, SSDI, and other benefits. We have the homeless prevention unit, and the world that I'm in is the street-based engagement program. And within the street-based engagement program, we administer the contracts to the outreach teams, the multidisciplinary teams in LA County. And as of, I think last month, we have 100 multidisciplinary teams. And I'm kind of like the clinical director on that side. So where does this story start? So by the way, I'm a graduate of the county program. I'm very proud of that. I'm from Harbor, UCLA. I'm a family doctor that was trained in Harbor, UCLA. So graduated 2015, and then in 2016, I started working at a healthcare for the homeless program in San Fernando Valley, where my home is. And over there, we started a street medicine program to care for people on the street. And it started as me and a CHW partnering with a wonderful organization called North Valley Caring Services, going out to the freeway at night and just giving meals and getting to know the community. And I think working at a healthcare for the homeless program gives you an insight to the best possible care that our people on the street deserve, the type of staffing they had, the type of services that they provided. And so that's what a lot of the inspiration that we got in building out the program for DHS. Within the healthcare for the homeless program, you have access to social workers, clinical pharmacists, dental, psych, primary care, and everything that an unhoused individuals might need. So it's a one-stop shop. And also somebody that could fix your insurance or enroll you into insurance if you don't need one. And after transitioning to Housing for Health in 2020, shortly after we had our COVID pandemic, and we rolled out our teams that did the COVID screening, COVID vaccination throughout the county. And during that time, we went to I'd say most of the encampments in LA County. We had 100 or so people working, maybe 200 people working for us. And we mapped out all the encampments in LA County. And in this, we mapped out about 2,500 encampments. And then we asked each of these encampments, what do they need in terms of primary care, urgent care, mental health, other specialty care. And that's the information that we use to build out our program. And one thing that we learned is that not every community has the same resource. So there are areas that don't have as much resource than others. When we look at Lancaster, Pomona, Long Beach, and everywhere, when we ran the data, we saw that there were gaps. And as DHS, we're always wanting to ensure equity across the board. And as the safety net of our of LA County, we want to ensure that there is a safety net for our unhoused population across LA County as well. So that's why we went out and proposed to the DHS leadership team, can we have a street medicine program so we could be in partnership with the other outreach teams, the other street medicine teams, where we could plug in the holes in the community, whatever that need is, whether they need us to be more of a primary care doctor, urgent care doctor, or a doctor that does addiction medicine, then we will complement those other resources within the community. That's a long intro. And this is our team. You don't see our faces, but this is us. Gold star to the one who could identify where this is. Uphill, nice weather, greenery.
It looks like it's Devil's Park, but I don't know about this side. But yeah, I don't know. It could be anything.
Yeah, it could be anywhere. This is actually a trick question because this is actually in Catalina Island. um, yeah. Just to show you that we will go anywhere in this county. There's not a place that we don't go to in the county. There's not an area that, and there's no one that we turn down based on insurance, immigration status, whether they're DHS or non-DHS. If they're unhoused, we're able to serve them. And we go where the community asks us to go. And as an overview, we do have a team of about 60 to 70 people made up of those health workers that I mentioned that we had at a Healthcare for the Homeless program. The idea was that to bring that complement of workers out on the street, because I think our people on the street deserve as much as anybody to have that level of care. So ensuring that the quality of care that we're providing on the street is at par of what you would receive here at the clinic here. So we do have 4 teams covering 4,500 square miles of LA County. So, and 60, 70, that's not a lot, but we are in partnership with those other teams as well. So there's one team in the north that's based in Van Nuys that goes out to Antelope Valley and San Fernando Valley. There's a team here that's going to be based, our new home here in LA General, very, very excited. That's going to take care of our central region. We have a team in the south covering South LA all the way down to Long Beach, Wilmington, San Pedro, and then there's a team in the east side. So from Pomona, Claremont, El Monte, Pasadena, all the way down to Downey or Coyote Creek, we have a team there. And we have a big mobile clinic, a 40-foot mobile clinic, which I think you'll see later on. And we bring out this big mobile clinic into the community. And our approach is that we're doing this with our community partners. So we're working with faith-based organizations like churches. We're doing this with drop-in centers, showers of hope, any community organization that's doing work, we want to partner with them because I think it's important to do this work hand in hand with our community, because you're already taking care of them out on the street, and then we're bringing in the clinical piece So and since we launched in September of a year and a half ago, we launched, and we've been to about, I'd say, 400 deployments since that time. And I'll show you where we've been. By the way, this is the mobile clinic. It's big, it's blue. You can't ignore it. So when out in the community, it's a conversation starter. There's always people stopping by to ask us, what is this? What are you guys doing? Are you guys doing COVID? Are you guys doing like, are you a vet program? We get all kinds of questions. But it allows us to educate the community. And we've actually gotten very, very positive feedback from the community about, hey, yeah, that's right, we should be doing this in our community. Except maybe for one area, I'm not gonna name as the city, where we got shouted out. Because there's always, the other side of but in general, the reception from the community has been very, very warm. And again, our mission is really to serve the people who are unhoused, our people on the street, all over the county. And there's 50,000 people. And in this, you'll see our one of our doctors before Dr. Kalili, and in one of the exam rooms. And what you might notice is that in this office, it just looks like any other room. And that's the idea, that the quality of care that we provide on the street is the same as the one that you would get in your clinic. So we have the ability to do pelvic exam. We have an ultrasound in the back, the same one that they use in the ER. We have all the equipment that they use at urgent care. Before this, we asked the urgent care clinic at Mid Valley, what do you use? Can we copy it so that we have everything that we might need? We have an EKG just in case somebody's having a heart attack. And the reason why we chose this big 40-foot mobile clinic, it's hard to park and there are areas we can't go to, was that primarily we also want to focus on the care for women on the street. We want to be able to do reproductive health right. We wanted to do it with dignity and not do it in a Sprinter van or a smaller clinic. So we're doing pelvic exam, we're doing screening for cervical cancer, we're doing STD checks, we do a lot of those screenings. And I mean, Nexplanons, the contraceptive management we do, because I think our women on the street deserve as much as anybody else. And side note, 1 in 8 women who are unhoused are pregnant at any one time. So very, very high rate. And that's why I really wanted to build out this portion of our program. We saw that there was a need when they did that survey. This is where we go. And this is the work of Matt. As you could see, and the bottom one is the Catalina one. And that's still part of LA County. And then on the census, they say they have no homeless. But when we went there, we went out in the mountains. There's homeless people in the mountains. And then we ran their record in HMIS, and they were also homeless here in the mainland. But there's people there in the mountains working for the industry in Catalina, and there's people on the boats that don't even get counted. So we're encouraging those places. And as you could see, the black dots are the ones that we've deployed the mobile clinic in. But this doesn't really capture all the places we've been to. And the red dots are the areas where we go by foot, just like you saw our teams go, doing street medicine, traditional. We bring out a minivan, bring everything else, but we go up by foot. So it probably doesn't capture everything since we just started capturing the street medicine efforts, but this gives you a good picture of where probably our concentration of homelessness is in LA County and where we are. So all over. And Carla said that you'd like to know this, but what do we see on a weekly basis? What do you guys do? And maybe I could just share a little bit about what I've seen in the past 2 weeks, because I've been covering San Fernando Valley, Antelope Valley, and I've had to cover kind of like areas in different parts of LA County just to give an idea of the work. I think beginning of this week or last week, I was covering in Hawaiian Gardens. We were partnering with a church group over there. And that's an individual that I saw, an 87-year-old Latino male who was homeless for the first time last year because they raised his rent in Anaheim. 7 kids, like raised them. But like I asked them, like, why are you in Hawaiian Gardens homeless? You have 6 kids, 7 kids that you could stay with. Why are you staying in your car? By yourself, you could barely move. And he said, well, my grandson is homeless here in Hawaiian Gardens, so I'm staying with him. And look at my car, he's actually sleeping. Like, oh, I didn't notice your grandson is in there. And so I'm working with the outreach teams and getting them a housing voucher. And then I do a verification of disability so that we get them housed. So that's one example. Yesterday, less than 24 hours ago, I was in Lancaster. I was in a new drop-in center with the organization called MHALA, great organization. That's part of our, they also have our multidisciplinary teams. And I saw this 50-year-old Colombian male that I saw one time before, and he said, I can't handle these voices anymore. The Colombian drug lords are telling me to kill myself. So I took the propane tank, I hid under my blanket, I released the propane tank, and then I would try to kill myself to stop the voices. So that was yesterday, less than 24 hours. So I had my social worker with me. Say, can you evaluate Steve? Our patient's really having a tough time. Can you evaluate him? And we called DMH home, who we worked with in the field. And then we took him to an urgent care psych facility and got him treated. So that was yesterday. And then 2 days before that, I was in Chatsworth. And I don't know if anybody knows that area. Plummer in Canoga on the west side of San Fernando Valley. I saw somebody who's just requesting medication for his addiction treatment because he's using fentanyl, but he's having horrible wounds in his legs. And now, as you guys know, with fentanyl, there's now this new substance that they put in. Anybody heard of tranquilizine? They call it the zombie wounds because the wounds are so bad. And it's like flesh-eating looking. And it's coming to the West Coast. It's coming to our community. It's in MacArthur Park. It's in Hollywood. It's everywhere. I see it now. And we're treating that. And we're doing wound care by the nurses. And I'm treating, and then I'm telling him, okay, I'll get you Suboxone. I'll get you treated. And then, but we need to see you regularly for your wounds because it's going to be hard to treat that. And then right here is a picture of our group, our amazing group. This is in North Hollywood. We're doing work on contingency management, which is a new program to deal with people who are using stimulants, meth, cocaine, because that's one of our #1 killer of our patients. The 5 things that are killing our patients, top 5 are overdoses from either stimulants or fentanyl and heroin. That's #1, overwhelmingly. The second one is cardiovascular disease, the heart and strokes, and homicide and suicide and traffic accidents. So those last 3, not sure how much we could intervene on, but at least the first 2, we're trying to do something about it. So we're doing a lot of these treatment for addiction, and we're rolling out this program where we give incentive if you are testing negative or for your meth, for your stimulant use, because we know that because meth is such a hard drug because living on the street is so violent, it's so depressing that people need meth. It's actually very useful for people to be on meth, and that's how they cope, how they cope with life. That's how I get up every morning. I need the meth. My friend just died from overdosing. I need to use something so I could cope with it. But it's incredibly destructive to the heart to the brain long term. So we're rolling out this program to keep people engaged. So we're bringing the mobile clinic. I'm doing their EKG, looking at their heart. They're talking to our social worker about their depression. We're working on their housing with our CHWs, and then maybe placing them if they're really, really sick into one of our facilities at housing for help, like for coop care or interim housing. And so this is us doing a deep brief about what else could we do better with our community here. And we want to roll this out all across the county. We want to provide access point throughout the county with this contingency management program. And heartbreaking, a family of 3 from Oaxaca, in the desert of Lancaster, a 2-year-old with speech delay, playing among places in the desert where there's like scorpions, snakes. Mom with seizure disorders in her early 20s. So we're working with them to get them indoors as soon as possible. When we see family in the community, we try to get them indoors as soon as possible. And then Tuesday probably had one of the most difficult conversation with a husband and wife. With our patients, we do a total body screening of everything: kidney, liver, diabetes, cholesterol, HIV, STD, TB test. We do everything. And in one of my patients tested positive for HIV, and she's in her mid-30s. And I'm talking to the partner also, I'm treating him. And at the same time, she's also positive for, when I first told her, it's like, oh, you have pre-diabetes. And she's like, oh my God, that's terrible. You also have chlamydia. We got to treat you. Like, oh my God, and you have syphilis, and you have HIV. And she is totally melted. And we got to find a way to talk to your partner because we got to treat him right now too. Yeah, so we did the screening for her. So that's kind of like the work that we do, just to give you a taste. The places that we go to in Spawan, in the desert. Yeah, I'll just zoom through these pictures because we're running out of time, so they give you questions. But this is Spawan, Spa 2, under the bridges and the ditches and urban areas. We do a lot of collaborations, like I said, with DPH. The home team, which is the outreach teams for DMH, we do case conferencing with them regularly. And I do the medical clearance so they could get placed, their TB test, and everything they need. LASA brings patients to us. The MDTs brings the sickest patients to us. So in a sense, we're the safety net of the outreach teams. So the sick ones, they send to us. And again, this is all coordinated with the other, as you know, there's other street medicine teams out there. And then the bottom left, that's all of us working together with the other street medicine team at MacArthur Park. Because we know that we got to coordinate our efforts together. So you see USC, CAC, UCLA, and us, because it takes all of us to hold our community. And spot 3, we park. I think this is in Almonte, the places that we go to. Again, I think we're not just doing street medicine or mobile clinic medicine, but I think we're doing social medicine. We're trying to address the underlying issues that leads to someone's homelessness, the lack of benefits, the lack of income. So we try and work on getting them housing vouchers, benefits, getting them placed through medical clearances with our partners. Under the bridge, we go. And just a picture of our team, Mariana on the top, on the RVs. This is Ronan, our provider. This is inside an SUV from somebody that can't really go outside of his that's Hollywood and the freeways. Yeah, and this is on the 10. This is us. We want to be able to walk together with our community because it's going to take all of us to do this work. Oh, this is a beautiful. I want to end on a good note. I've been so depressing to you guys. Um, this was an initiative by our staff because we know that women's health is so important that in one of our mobile clinic days, I said, let's, on Women's Health Month, let's dedicate a women's health drive. So they brought out all hygiene kits, flowers for our people. And then we're going to outreach to all the women in this community in El Monte. And like condoms, HIV kit. And we're really going to focus on the care for women on the street. And as you know, our program are held up by strong women here. Yeah. So thank you.
So do we have any questions or comments? Okay, thank you, Melina. We'll do them in
I always
order.
have comments, right? But I just want to say, you said that this was like a depressing thing. It's not for me. It makes me very, very happy because we had none of this kind of thing before. I mean, I remember when the street medicine started with Dr. Can't remember his name, but you know who I'm talking about. She does. I don't know if the rest of you, but um, you know, being here, just the Northeast area. I mean, Boyle Heights originally isn't Northeast, but we had no services, and we still have limited services, even though we're so close to things.
Mhm.
But for the population, it's hard to get to things. So having this is very good, and then the coordination is the most important thing
Mhm.
because we don't know what this person is doing, and without that coordination, we can't really help the population. So thank you for this.
Mhm. Thank you.
Thank you, Dr. Galat and your team. I learned so much. I had never heard the term social medicine. So I'm going to take that away. But a couple of questions that I have is, how can individuals or organization request a partnership with you? And the second question to that is, once you're stationed, what are your hours of operation?
Yeah. For organizations, we do have that we want to partner with. We do have a team that is overseen by Matt, and we do have so any organizations that wants to touch base with us, we direct them to Matt's team, and then they're the ones that are in communication with the community partner about location, the site, if it's the right population, like do you serve the homeless? Is it aligned with our mission? And that's how we start the partnership. And it's usually a very quick. We think the site is right. We're very quick on it, and then we're there. Sometimes we could pull it off within 2 weeks. So if there's any partnership like that, that's I mean, you've seen the map, but there's 50,000 people on the streets. We're in a lot of areas, but we're not in all areas. And in a way, we're still a very young program. So there's still a lot of room for growth. We are in, I mean, Matt is in discussion with the 88 cities of LA County, with the 15 council districts, the SDs as well. So we're always joining those outreach coordination meetings to hear of new areas or forge a new partnership. In terms of, so that's why I punted to Matt. In terms of the hours, it's usually we get there. Having this big blue truck is a pain. Sometimes we're driving it an hour just to get to the desert. So we may start a clinic like 9-ish if our team starts at 7:30 or 9, and then we go until like 2-ish because we need to get back, run our labs. So that's kind of like our
Okay,
hours.
and then the last question.
Yes.
You said you mapped a lot of the encampments and houseless communities. Is that a public facing or that's very internal to your team?
Internal for now, though I'd say that has been outdated. Not sure how useful it is because the amount of movement or mobility our patient has. But I think LASA has one, but it's internal.
We do have one comment in the chat, basically saying, thank you so much for the incredible work. And then how do we get your contact information?
Yeah, we do have a mailing address where we get referrals, and usually we're getting referrals again from like the outreach teams. So because we have a system in place where our first responders to say are our outreach teams, and then they send it to us. So because they're able to triage the need, and then if there are a lot of a clinical need that they can handle, then they send it to us.
We also have a raised hand from David Galavis. David, would you like to ask your question?
Yes, Heather, thank you. I have a quick question for the doctor. It was mentioned earlier by a community member, the need for coordination. This is phenomenal that you're doing this, and I'm glad to see the big blue um, mobile unit that you use. But are you coordinating efforts also with the School of Medicine at USC and with the City of Los Angeles, which really focuses on the East Side and Northeast LA and South LA communities?
Yeah, so one thing I did mention in terms of coordination is that we have a monthly meeting that is convened by the Community Clinic Association of LA County, where all of the street medicine teams come together, and then regularly we are broken up into like who's ever working in a region, and then we're coordinating. So there's real time coordination. So yesterday I saw a patient and I called up the UCLA team. Hey Hannah, what are you doing for this guy that I think has a bicep tendon rupture? I do have the contact, for example, of Dr. Camilo Sachs, their medical director. So we are in collaboration. Yeah.
I know we have another question in the room.
Hi, you were referencing Matt to learn about site specs. Who's Matt?
Oh, Matt Tekle, right here. Yeah.
Hi, okay, thank you. And then I also wanted to ask if there's any neighborhood pockets within LA County that you're trying to reach that you've not been able to.
I think it's up to the community at this point. We're always trying to like hear things on the ground. We do have a weekly. Matt's team, our coordinating team, are always in touch with our teams on the ground to hear back feedback about places that they're seeing, but we don't have eyes and everywhere. So we might not know where we're not going. We're trying to so we created our schedule so we have a consistent biweekly schedule in the community that we're going in consistently. And maybe a good segue to why we're doing our transitions of care program here at LA General, because our goal is really to like see the sickest and prevent people from dying from the street. And in order to keep us honest, and I had the same worry about you, are we going into the areas that where we need to be? I think that's the biggest question, where there are people most need. The people of most need are showing up in the ER, in the hospital. And so that's why we're now that we're home here in LA General, we're going to be able to start a program where we're going to be able to follow them out when they go back on the street. So I think that will lead us to these communities that we might not even know about. And that's really why it's so important between the partnership with the hospital and in the community. And we're going to be the bridge for that. Yeah.
Hi, I have a quick comment. I agree with the lady over here that this is a paradigm shift. It humanizes, I think, what people call the homelessness problem into something else. I would encourage, as this program develops, to try to get this out there, publish it. I don't know if anybody else is doing this, but it really helps humanize, I think, a lot of the very intimate problems that people who are housed face. So as it moves forward, I hope there's partnerships also built towards publishing. Thank you.
I'll take the compliment, and I'd say we're probably the biggest street medicine program that I know of anywhere. And it's here in LA County because we had the biggest problem. And you know, we have a bigger goal. We want to end homelessness. Yeah. Thank you.
All right, well, thank you. Dr. Galat and your entire team. I think this presentation was very humanizing and very eye-opening about the challenges that are faced by not only our unhoused population, but those that go to serve them. And just thank you again for the wonderful work and for sharing that with us today. And again, as a reminder to everyone, we do have an opportunity to view the mobile units that Dr. Galat was referencing. They're going to be in front of the inpatient tower in that turning circle, and I believe on the street corner. So please, when you leave, you can take a left out of the building and take a visit and see what some of those facilities look like. So thank you again so much. We're excited to move on to our next presentation. I'm delighted to welcome two members of our Health Innovation Community Partnership Co-Design Committee. Pam and Monica are going to introduce this topic, and we're excited to have an interactive exercise here today to discuss the issues of homelessness and housing in the East Side communities. With that, I'll introduce Pam. Let you take it away. Or Monica. Monica's going to go first. Fantastic.
No, I'm not. Hi, everybody. So I work for Exodus Recovery, and I work with the population specifically that has mental health and substance use and everything. So I've seen it all. And I'm really excited about this presentation. I'm not going to say too much, and I will answer questions as much as I can. But the biggest thing is that we see a lot of programs coming in to help, but there's still so much that we need, right? The program that they just talked about is amazing, and we have more housing and we have more things, but the reality is that there's going to be more people that are going to become homeless, and so we need to prepare for that. So I'm just wanted to put that out there, and then Pam, you want to go ahead?
Thank you, Monica. And just so that everyone knows, in co-design, Monica also centers and is the voice as we plan what the HICP future conversations. I really appreciate your voice. So I'm Pam. I'm with the Eastside Leads Coalition, and just to skip, I want to introduce John Urquiza, born and raised in the Northeast, a Wilson High School graduate, a true Eastside hijo. I met John in 2018 as Eastside Leads, we believe in equitable and accountable investment. And I met John and his Occidental students doing community engaged research. Today, you're going to hear from him. You're going to hear from his 20 plus years experience as an art director and designer, but how he brings that into his visual journalism. He is an educator, like I said, an organizer with an artist collective called Northeast LA Alliance. Nela no se vende. He is also, like I mentioned, adjunct professor and guest lecturer at Occidental. And he focuses on anti-gentrification processes and many other subjects. Also, a coffee snob. With all that, thank you, John. I pass it to you.
I just want to say that I've known John for a long time. We actually opened a shelter. I've talked about recycle resources, and he was there helping in the anti-gentrification movement. He's amazing. So glad he's here.
Yeah. Thank you. Can you hear me okay? Okay. I tend to walk around a lot, so I apologize. And I'm also going to speak really fast. I want to hit a couple things. Has anybody ever experienced or done any types of community engaged research? Or have you ever read any research of that nature? You have? You have? What did you guys think about it, or how did you feel about it? What did you learn more that you couldn't have learned someplace else? Any? Nothing?
When I think of community engaged research, I really think that you're going in and trying to get the information from people, from the source, as well. So you're going to get the information from the source and really not framing the problem as you see it, but as the community sees it.
Exactly. Thank you. So That's exactly it. We're looking at the community and the community is speaking to us. In a lot of cases, the community leads it and says, these are the issues that we need to talk about. Or it's not a panel to say this is okay or not okay. They're actually leading it and saying, this is what we want to do and this is what we want to learn about. So this is a lot of what the organizing that we do as well. We did a research study in 2017, 2018 called the Vulnerabilities Study, which looked at 1,800 parcels in the Northeast Los Angeles area. And we nailed down, we were trying to figure out where development and displacement was going to happen. And we developed some metrics. We had high school students, we had Oxy students, high school students from Lincoln High, high school students from Sotomayor helping us on this. And we looked at these parcels and came up with a predictive model. And, oh, I forgot to do my land acknowledgement. I need to look at my slides when I'm talking, sorry. So anyway, so we did this and we found we could predict where it was going to happen. And the beauty of this is that we did this in 2018. In 2019, the county developed their predictive model on displacement and such. So we were kind of ahead of the schedule. So when we look at the community engaged research, it's on the ground, it's happening, it's real time. How do we use it? So I'm going to show a couple things that we've learned from those processes. Also, the handout that's out here, this has a lot of our resources, so check it out if you want to learn more about something. Oh, awesome. Okay. I love laser pointers. If I
Also, we, as John is putting the slide, please, if folks can sit at tables, 7 to 8 people per table, this will be great because you will have a chance to connect with your peers in this presentation. Conversations, what we want. So please, don't be shy.
So before I go any further, I want to do a land acknowledgement to the Tongva. Is anybody here Tongva or represent the Tongva tribe in any way? If you want an opportunity to say something, that'd be a good time. If not, I'm just going to move forward and say that Tovangar is the area that we're in. This is Los Angeles. This is Los Angeles Basin, including Catalina Island. The translation is the world as we know it. Right now, we're close to the Yagna village, which is the Union Station. And also, if you go towards El Sereno, you have the Ochunga. And then that Ochunga area kind of straddles Alhambra, El Sereno, even down towards Mission Road. And then you have the Jajamonga, which is up in Altadena, but comes down the Arroyo Seco. So these are all kind of like, this is all Tongva land, and we want to acknowledge it, that this was their land first, and that we're guests here. Today's outcomes, we want to look at 4 things: protections, equity, autonomy, and health. And I'm going to go into these really quick, or I'm going to go into them as we talk, but just keep those in mind: protections, equity, and autonomy, and health. And these are all issues and things that we learned about in our community engaged research over the last 10 years. And are we doing the map thing? Or
we have the map in the back, of
okay.
course, for those in this room. Please feel free to add your dots to our physical map. And then we have the map exercise.
burned down and moved to its current location, which is now where Sonora Town is. Sonora Town was a little village of mostly folks from Sonora that again was also burned down. And the folks who started that ended up starting La Puente. And they were community members, folks who built this beautiful community of adobe homes and had street discourse and highly political active, and it was just scraped off the face of the earth and was taken over by industrial elements to turn it into the rail yard at the time. And then Chinatown, the new Chinatown is right above it on Broadway. Maybe you guys are old enough to remember Bunker Hill, what that used to look like. Anybody? Nobody remembers Bunker Hill? Okay. It was a community much like Highland Park with old homes, diverse neighbors. It was a Filipino neighborhood. It was an indigenous neighborhood. Folks from Arizona had moved to the Los Angeles area, and this is where they were living. It was a Mexican neighborhood. It was an LGBTQ neighborhood. That was, and then scraped off the face of the earth. And what we have now is skyscrapers and the cultural centers, international cultural centers, with the names of all the famous families of Los Angeles on there. These are all parts of what's happening around our area. We also have, is anybody old enough to remember the interstate system when they built the freeways? Was anybody affected by that, by the freeways? Okay, you guys are all really young then or something, because I can tell you my grandparents lost their house to the freeway. That wiped out huge swaths of Boyle Heights and East LA, and then the 5 freeway as well. Nowadays, currently, we have also in this spot right here where the USC hospital is now, or the USC University stuff is now, that used to be a village of about 350 families. Gone. Okay. The green area is known as, or it's no longer viable, but that was the known as the biotech corridor, and then the purple area is known as the Los Angeles River Revitalization Area. The river revitalization is expecting $6 billion in investment, and the biotech corridor was expecting at least $8 billion investment. But there's one more thing that's not on this map. Has anybody ever heard of CASP? Cornfield Arroyo Specific Plan? That was that's an area from up here down to here, about 900 acres of industrial land that they rezoned for housing. Less than 10% of it is going to be affordable. And I'm going to get onto affordable in a second, but less than 10% of it is that. That's 900 acres. One of the councilmen characterized it as an entire new city in between Chinatown and Lincoln Heights. 14-story towers of supposedly housing or market rate housing in that area. They don't even have a number for the investment on that side. So we're looking at billions of dollars of investment and a lot of displacement that goes along with it. Anybody been affected by these at all? What happened? What was the effect of any of these, and which one was it?
So displacement, when I was younger, they moved us because somebody bought the building or the houses. So we moved in my community. I will tell you, I grew up with the same people, went to the same school, and we still knew each other. My daughter started elementary, and she has none of the children that she went to school with are living in our community anymore. So, and our community is changing. It doesn't look for us. Everything that comes in, businesses are not for us. They're not affordable. And people look at us like we don't belong there. So I've been very displaced. I mean, we've been displaced. The rents, our families too, again, double our rents. And not just me, it's several people. So I always say gentrification, right?
Okay, but not to any, you weren't part of the freeway or?
No, not the freeway.
Okay.
Oh, well, the 710 one, they wanted to come through us. I didn't.
Okay. Was anybody else any of those instances? I know that the freeway, when it came through, oh, yes.
Yeah, actually on your map, my family actually was displaced from Chavez Ravine, and that's how we, oh, thank you. Yes, my family actually were displaced from Chavez Ravine. It was my great-grandmother, my grandmother, and then my aunts, uncles, and my mother. And that's how we ended up moving to Boyle Heights.
Thank you. I'm sorry, I forgot to mention Chavez Ravine and the 3 villages that were up there. And yes, you moved to Lincoln Heights. We had a bunch of folks, I've met a bunch of folks that in families that moved to Frogtown in the Elysian Valley area. I've seen them in Highland Park. And it's a traumatic experience for some families. I know one family whose great aunt was the one that was carried out in the famous sheriff photograph.
Excuse me.
They're still, the whole family's still traumatized by that. I was gonna say that even in my family, when the interstate took our grandfather's house, my aunts and my mom fought for 40 years over that idea of what, of what happened. And they didn't heal until 40 years later when I was an adult. And so there's trauma that happens with these displacements, and it can become generational if we're not.
And there's actually like 3 communities within the Chavez Ravine. It's La Loma, Bishop, and Palo Verde.
Yes.
My family's home were actually right on Bishop, and I actually have documentation to show that that's their actual address, which is really nice to have.
Yeah. So yes. Anybody else experience any of these at all? Okay. I'm going to move on. Changes in perspectives, changes in insights. That map looks cool. So what we saw earlier in 2015 in gentrification was a lot of displacement, direct displacement, where somebody would buy a building, empty it out. I was part of a rent strike called the Marmion Royal Apartments on right next to the train station. And day one, the second the owner took over, 57 families started being evicted, and eviction notices were delivered. This is in Highland Park. Now, that's a direct displacement. Now we're seeing indirect displacement. Indirect displacement is when investments come in and they raise the value of land and they raise the value of rentals, and they create displacement. So they create this forced economic migration. And this is what we're seeing nowadays. And I'm going to talk a little bit about that. And an example of another set of changes is in Lincoln Heights. And I bring up the median income because I'm going to talk about the AMI and affordable housing in a second. But the median income from 2018 to 2023 has changed in Lincoln Heights from 44,000 to 54,000. Did an employer come in here and suddenly give everybody raises? Everybody's shaking their head no. Why do you think, what do you think happened? You moved back in? Mm-hmm. Okay. But it's not all bad, no. What I'm trying to get to though is why would we have such a raise in median income values in Lincoln Heights? In El Sereno, it went from, hang on. It went from 50,000 to 71,000 in that same time period. Yeah. Yeah, not everybody makes that. But Mm-hmm.
One of the types of books that you earlier mentioned about community-oriented perspective. His views on gentrification are not really. So some of the views on gentrification here aren't necessarily endorsed by some of the research he has done. He's a professor at Columbia University, planning professor. So with this specific graphic, all I would say is that maybe the sons and daughters of the communities are coming back a little bit more juiced.
I agree with you on some of that, but also we're seeing a more affluent families coming into the area. Okay, and that's what's, yes, but that's what's creating the indirect displacement, because the affluence is raising the value, and that's all I'm trying to say. How do we, well, that's another issue, is how do we deal with that? How do folks, counteract that? In some cases, I've had this running conversation with a guy who owns a coffee shop who came into the Highland Park first. And, he says, I was making $35,000 a year when I first moved here. And I'm like, yeah, but you're one guy and a wife, and that's it. And the people who are making $35,000 a year have 4 kids already. And so you were never equal with them. You always had more and more impartiality. So how can he kind of like take his business and make it more equitable? So it's tough, but he's managed to do it. He only hires Latinos now. He does give a lot back to the community whenever he can. He donates to a lot of different things. So there's offsets to do that. Some folks have become part of the tenant unions and help a lot there.
And I want to
the offset
interject,
is different.
just because of time. And remember, you're going to have an opportunity to talk as a small group, agree, disagree, see other perspectives in this data. The purpose of the data is to spark this conversation. So again, I want to invite folks to sit in groups. Time check, go.
Okay, sorry. Thank you. So that's one change. Another change, or something else that we know is, in the state of California, this is what we have: 45% renters, 55% homeowners. That's pretty balanced, pretty equal. In Lincoln Heights, it's 72% renters, 28% homeowners. In Chinatown, it's even greater. It's 89% renters and 11% homeowners or owners of land. So how we talked about, what are the 4 things that we're looking at? One of them is equity. How do we bring equity to these numbers? How do we bring some of the other things we talked about? Okay, this is where I'm going to nerd out, so bear with me. This is part of the study of the maps that we did, and since I don't have a laser pointer, I'm just going to like walk up and put my fat finger on the screen here. We talk about USC, LA County as kind of like an epicenter for us, and so that's why you see these red lines. These are impact zones, but each of these targets that you see here are developments, and there's probably 30 of them just in this part of the map. If you go north, there's another 25. And this originally started as a community engaged research where we had high school students going out with their cell phone and tagging something that they saw and putting it on the map and saying, oh, I saw a potential encampment here, or I saw a potential displacement because there was furniture all over the sidewalk, and I think somebody got kicked out of their apartment. So we were mapping those things, and then they started mapping like developments, and so they said, oh, they're building new houses here. So we started adding those to that, and then it grew into this. And so I'm going to cover a few of these because a few of these are some of the issues that we're facing in the community and across Los Angeles. I'm taking up here to where it says El Sereno, that target where the mint little polygon is. Can y'all see that? That is a development called the Eastern Lombardy project. They want to build 42 $1.3 million homes on that parcel there. $1.3 million homes that's going to indirectly displace or affect 800 renters in the buffer zone that contains that. There's 800 renters in there, and that neighborhood, again, in that same buffer, is also has an 18% poverty rate. If you know the national average is, anybody, 11, 12% right now? 18% there. And so the impact of $1.3 million homes going in there is going to be huge. It's going to hit the rents really high. That's a group that we're fighting with in El Sereno. They're actually petitioning the Supreme Court to hear their case because they were able to win on environmental grounds. There's 111 black walnut trees on that property that are protected by the state, and that's how they were able to stop it. However, it doesn't. The the developer has come back and says, oh, no, 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 you sued us too late. This is invalid. So that's what we're asking the Supreme Court to decide. That's a potential. But I also want you to call attention to the orange spaces that you see throughout. You see the other mint one up here, the very large one, and then the little Target. Those are two separate projects. The little Target one was also 32 homes, about $1 million each, in a neighborhood that had about 18 to 23% poverty rate. And then next to it, that really large plot, that was 70 homes on a hillside. 70 homes in Lincoln Heights. Is anybody familiar with, oh my God, I used to hate going there because I always got scared. I always got beat up there. Happy Valley. You know Happy Valley? Anybody else know Happy Valley? Tough neighborhood. Right on that side of that hill, 70 homes. Okay. We so lucked out on this because the developer went bankrupt, and right now it's an empty lot. But I want you to call attention to all the orange spaces. Those are open hillsides that could be potentially developed with luxury housing. And there's hundreds of acres of it. And that's part of what the El Sereno groups are trying to do, is preserve some of that land and get it saved, and create these green spaces that we don't have a lot of in this community. I mean, we have green spaces, but they're all private. They don't belong to us. They belong to somebody else. And I'm gonna move across counterclockwise. That green spot with the Target right around where it says Flora at the very top, that's one house that is 894% bigger than any house in Lincoln Heights. It's a 10,000 square foot house for one family. That's a project that we signed. And then you see, again, it's in that red, in that kind of like that orange land. And there's a bunch of little houses around there that are also like 3,000 square foot homes that they're trying to build. This is luxury. Now, what's interesting is if you look at this, in the center of this is LA County, USC. On the bottom, we have a lot of apartments and more transient housing, but on the top, we have a lot of luxury housing. And that's kind of how it's shaking out right now, how things are moving through the community. If you come down to, I want to say around here, where it says Glendale Junction, San Fernando Avenue 19, we have around there, we have a brand new 200-room hotel across the street from the St. Vincent de Paul, if you know the neighborhood. They haven't had any business as a hotel, so they're starting to convert those into luxury apartments now. Also around that area, just across from that, you go up, you see those two little, oh, that's me. Or is that me or is that you? Okay. I forgot to put my time thing on, so keep track of it. Keep track of it. Those two little points. Has anybody heard the toxic site on Pasadena Avenue? I know you have. It's 480 apartments on Pasadena Avenue, and there is a toxic waste below it, but they've mitigated it by creating these venting systems so it doesn't get trapped or go up into the housing. That actually went through. They couldn't stop it. That's being built up. That's going to change that neighborhood hugely because that's 400 units. Let me get two more out of here. I'm going to kind of switch down here. I'm going to come down here. This is Cesar Chavez. You see these little spots here. This Target was actually a building that was defeated recently. It was 55 units, luxury units. They did no qualm about calling them luxury, but around it, these other buildings started to build up around it because they wanted to capitalize on this particular development. They won this one because the planning department commissioners said displacement's going to happen. There's going to be health effects. This is the first time we've ever seen this in the planning department. The 10 years I've been going to the planning department, that's the first time they've ever listened to the idea or the arguments of displacement. So that was a win. However, this next little Target on the next block over is using something called Executive Directive 1, which says if you're going to build affordable housing, you get a free pass and you get to bypass the planning department and you get fast track. The problem with that building is it's a 10-story building and there's only 19 units on it that are supposed to be affordable. The other 7 are going to be a museum. And it feels like they're trying to beat the loophole there. By calling it affordable, they're getting past a lot of stuff. So we need to react to that law that's coming in. That's came out of the mayor's office. This is another one on Wabash and Evergreen. That's another ED1 project or Executive Directive 1 project. Same thing. They're losing community control over it. They have parking issues. They have all kinds of issues in that community that they cannot address because that building was labeled as affordable and it's going fast track and they cannot answer any of those questions.
Thank you, John.
So protection, equity, autonomy, and health consequences. I didn't get too much into that, but I do want to talk about, just give me a second for autonomy, or I'm sorry, for health consequences. You guys, I mean, I've heard so much about health today. I'm super amazed that you guys probably already know this. Has anybody heard of root shock? Root shock? Okay, now I'm amazed. Root shock is a phenomenon that happens during gentrification or displacement, and it creates, again, like we were talking earlier about the trauma of being displaced. It can be a generational traumas, but that's something that people aren't studying, and there's some good articles in this handout for that. The one thing, there's a study that was done out of South LA. One study that came out of it that I can confirm with it, because we saw a lot of it when we were working with tenants at buildings that were going through a rent strike, is that the psychological effects of this. They're isolated, they're scared, they don't know where they're going to live. There's a loss of control because they cannot hold on to their housing. They don't, there's a shame to it. I mean, and I see this in businesses that are being displaced too. There's a shame to not being able to, to hold on to your space, and they pay the rent, but the rent's going up. Rent can go up 300, 400%. I was displaced from York Boulevard with a 300% rent increase for my business there. So there's a lot of emotional connections to this displacement, and that's something that has not been talked about a lot, and that is the root shock that goes along with it. And I think that's it. I'm going to turn it over to Pam so we can do these exercises.
Yeah, but I don't think that, hold on, let's see time. 2 minutes. Next slide. You have the slide, John.
You can do it from there?
Yeah.
Okay.
Okay. So, yeah, it's really, I see connections, everyone. Today's presentation was community-centered data. Research that started with high school students, research that Isai Leeds and Nella are building upon. We brought you just a little taste, just like our doctor earlier mentioned, what he sees on the ground. This is what Isai Leeds hears when we do tenant rights education workshops. Families come facing a lot of things. Before meeting John, I didn't know the word root shock, but I heard it in the families that were experiencing eviction and sure houselessness. This is iterative. This is a visual. Each and most of the site fights have an organized community group forcing autonomy. Now that you have this knowledge as Health Innovation Community Partnership members and members of the community, we want to know your thoughts. This presentation is just the start of the ongoing conversation that we want to continue to have. Think about it. What can your agency, LA County folks, do to create equity and have solutions for the issues that we just presented? 2, how can your agency, your group, your business, your family, you as an individual, develop autonomy, community control in this process of investment, of development, of community change. Lastly, when we say predators, we just mean the doctor mentioned houselessness is violence. So we mean like change can happen really quickly. What is your role to make sure that that change is not negative to your community, your tribe, your home? And last, you heard root shock. You heard that that means physical, psychological effects of displacement. What can your agency do to protect? These are questions that unfortunately we don't have time to discuss today because I know you want to go look at the mobile home clinic, mobile health clinic. But if it's okay with a partnership at our next month's meeting, or when we see the homelessness number published, we would like to bring these questions to HICP. For now, I hope that you leave with these questions in mind. And in the last minute, 1 minute, any clarifying points before we turn it over to Heather to walk us to the mobile health clinic? Questions or comments?
I just want to say something. I think it's very important to understand that the fact that you were able to come home, it's amazing, right? But a lot of people don't have that privilege. I know that if I were to move from where I live, I probably wouldn't be able to live in Highland Park. And I've lived there all my life. I think that my son, he lives in Brea, you know, he moved, but he probably wouldn't be able to afford a place in Highland Park. My daughter, she's going to go off to college. Will she be able to come back? We want people like you to come back to the community that they grew up in, right? So I just wanted to say that.
I'd like to make a few statements is that I moved out of my community, but I still had my family here in Boyle Heights. I came back to my community to also give back to my community. But I also find that for people in my financial bracket are having difficulties coming in because they are being turned away because they do not qualify for the low income housing. So now they're actually being forced out. So I think we have to look at also the equity on both sides of the spectrum. So had I maybe come in today, I probably would not be able to come into an affordable housing complex because I would not qualify. And then also, I know we use gentrification, but it's also a part of economics. Because, for example, if a bungalow or duplex is sold, maybe the family doesn't want it, whatever the case may be, whoever does buy it, I think that we also have to focus on the real estate industry, because they're the ones that are actually creating the economic issue where if I lived in that duplex or bungalow and it was sold, I would have to leave, not because it's just about gentrification, but the new property owner had to pay so much for that property because of the real estate industry driving up the cost. That is also another issue with why we cannot stay in those bungalows. So I think that's another, issue that we should probably focus on. I think it's really important to open it up to all of these avenues so that we can learn more about the restrictions on having to stay in our communities and who's buying up these properties. I know LLCs are opening up everywhere. People are getting together as a group and they're opening up all these LLCs, buying up property, demoing our beautiful historic places. The one thing that I know that we can do as Boyle Heights Community Partners is that we actually do landmarking to actually save spaces. The International Institute on Boyle Avenue was slated for demolition. but because we actually had a historic, an HCM application, had it approved, of course, the property owners were not happy because then it became a landmark. And they wanted to demo that particular place just so they can put up office spaces and ruin the corridor of where Boyle Heights actually began on Boyle Avenue. So we're also having issues with that, but because we do landmarking, it's really important. Lincoln Heights has an HPOZ, Historic Preservation Overlay Zone, so they are very, very well protected. So it's even harder for them or for any developers to really come in and try to demo a lot of these properties. So it's also important that we learn more about alternatives and really reach out to the spectrum of other things and not just the term gentrification, but it's also a part of economics. Thank you.
Thank
If I may
you.
respond,
Well, sorry, we could have a huddle, everyone, but we really want to see the mobile health clinic. Yeah,
okay.
no, but thank you for all of your feedback.
Absolutely. I want to thank again Pam, Monica, and John for kind of initiating this conversation. We know this is not a conversation that is one and done. It is a conversation, it's an ongoing dialogue with our community. And really part of the real purpose of the Health Innovation Community Partnership is to come together and discuss these neighborhoods surrounding the LA General Medical Center, the needs of those communities, and how we bring community voices, community-based organizations, and county agencies together to kind of address and respond to those needs. So we've had some really wonderful presentations today. We're very excited to be able to move forward with some partner announcements. We want to make sure we have a little bit of room for partner announcements. I'll go right ahead with the first announcement that we'd like to make is a warm invitation to all of you to join us at our 10th Wellness Center anniversary. The Wellness Center at the Historic General Hospital, which was a community partnership. It was kind of like a precursor to the Health Innovation Community Partnership to bring lots of community resources together to serve this local community. We celebrated our 10th year as a center in March of this year. We had a rain out of our planned anniversary day, so we're super excited to invite everyone back a week from Saturday. It'll be on the steps in front of the Historic General Hospital. Come join us, all of our partners. It'll be a family-friendly day. And of course, we have a wonderful concert by La Sonora Dinamita featuring Vilma Diaz. So come put on your dancing shoes and join us. I also want to invite my colleague Eddie Padilla to give us a quick little announcement about an upcoming event in the community.
Hi, everybody. My name's Eddie Padilla. I'm a board member for Casa 0101 Theater down the street here in Boyle Heights on 1st and St. Louis. I'm also the lead youth educator at our theater, and we're really happy to partner with the Wellness Center on a project for ending the HIV epidemic. In this very short 6-week program, the teenagers from the Ending the HIV cohort have put together a short play that is including audience participation, and it's called Spread the Word, Not the Disease, What Teens Want You to Know, and it's happening on Sunday, May 19th at 3 p.m. There will be food, so we encourage you to please come. Enjoy the performance, invite teens, invite adults. There is a little bit of a parental advisory. Topics for the show and post-show Q&A may be sensitive or explicit and could include a bunch of things that are on the flyer that you could find out on our table in front. In addition to that, we also want to invite people that are visiting today and that may or may not be part of the HICP yet to please join us in the CACHI steering committee. We are looking for more members specifically that may be serving youth and teens in behavioral health. Thank you so much. Talk to us out there.
Yeah. Thanks, Eddie. Please feel free to visit the resource table for additional information. Any other announcements from partners? Okay, well, thank you all so much for joining us in person today. And thank you, of course, to our Zoom attendees. We're very grateful we're very grateful that everyone was able to participate. I hope the hybrid experience was a good one for both of our cohorts, and we'll keep you posted on future in-person meetings. A thank you, as always, to our fabulous presenters for sharing their time and their experience and their wisdom with us. And of course, as we get ready to leave today, please grab a snack on your way out, but also please do stop by to visit our mobile health units to see in person what the facilities are like that Dr. Galat and his colleagues use to go provide that life-saving, valuable care to our unhoused community members. Thank you again for coming today. Oh, fill out your feedback forms. They are on your tables. Please, please, please fill those out and leave them at the registration table, the purple table at the front. We want to hear your thoughts and opinions about this meeting so we can make future meetings even stronger and better. And I want to give a personal, very warm thank you to my entire team that helped pull this event together. Believe you me, it's been a long time since we've been in person. And so it is one of those things where it takes a village to make all the pieces come together. So a very, very big thank you to everyone on the team, and in particular, Elijah and Cassandra, who really made this work today. Thank you.